ကုန်ရ
ရေးသမကျရပါတယ်ချမ်းတော်ပဲဥစား
ရတယ်အေးနေ
ဆရာရပါလားဟုတ်အခုကျွန်တော်တို့စီနီမျိုးကနေပြီးတော့ရင်ကြိုးဆိုပါတယ်ဟိုဆီယမဒေါက်တာစန်တာနဲ့ဒေါက်တာနှင်းနှင်းလင်းတို့ကြိုးဆိုပါတယ်အဲ့တော့ကျွန်တော်တို့ဒီဆီယမတို့ဟာမျိုးဆက်ပွားကျမကြီးဆိုင်ရာမူဝါဒဖွံ့ဖြိုးရေးအစီအစဉ်နဲ့ရောက်ရှိလာတယ်ကျွန်တော်သိရပါတယ်အဲ့တော့ဒီကိုရောက်လာမယ်မရောက်ခင်မှာကျွန်တော်ဗမာယူမှာပေါ့လေဒီမူဝါဒနဲ့ပတ်သက်ပြီးတော့ဗားရင်းများဆောင်ရနေတယ်ခင်ဗျာ
ကျွန်တော်တို့မြန်မာနိုင်ငံမှာတော့ဒီပေါ့ကျွန်တော်တို့ကမျိုးဆက်ပွားကျမကြီးနဲ့ဆိုင်တဲ့ဌာနကိုလည်းနေတယ်ပေါ့နော်ကျမကြီးဝန်ကြီးဌာနအောက်မှာဆောင်ရွက်တဲ့အနေနဲ့ကတော့ကျမတို့မှာဒီမျိုးဆက်ပွားကျမရေးဆိုင်ရာမူဝါဒဆိုပြီးတော့ဒါ2002ခုနှစ်တုန်းက
Myanmar Reproductive Health Policy
ဆိုပြီးတော့ရှိထားပါတယ်။နောက်အခုကျမတို့9နှစ်တခါဆွဲနေတဲ့5-year strategy plan ပေါ့အဲ့ဒါလည်း reproductive health နဲ့ဆိုင်တဲ့ strategy တွေပါပဲ။အဲ့ဒါကတော့5-year reproductive health strategy plan ဆိုပြီးတော့ national plan အနေနဲ့ကျမတို့ဆွဲတယ်။အဲ့ဒီအတိုင်းကိုကျမတို့ကဒီ implementing partners တွေနဲ့ပူးပေါင်းပြီးတော့ဆောင်ရွက်တာရှိပါတယ်။
အခုလောလောဆယ်ဒေါက်တာနဲ့တုံးပြီးနေတာအခုလောလောဆယ်အခြေအနေမှာကျွန်တော်ဗမာနိုင်ငံကျန်းမာရေးတက်ပေါ့လေဒီအမျိုးသမီးတွေနောက်ပြီးတော့ဒီလေငါပဲဆိုင်ရာပေါ့ကျန်းမာရေးကုသမှုတွေများဘာတွေများဆောင်ရွက်နေပါလဲဘာတွေများပေါ့လေအခက်အခဲရှိနေပါလဲခင်ဗျာ
ကျမတို့ဒီဘက်ကမြန်မာနိုင်ငံကကျန်းမာရေးဝန်ကြီးဌာနတော့ကျမတို့ကျန်းမာရေးဝန်ကြီးဌာနအချထားတဲ့အမျိုးသားကျန်းမာရေးမူဝါဒပေါ့နော် National Health Policy မှာဒီ maternal and child health issue ကတကယ် priority issue က priority ဦးစားပေးအစီအစဉ်နဲ့ရှိပြီးတော့ကျမတို့မှာဒီဘက်ကအမျိုးသားခုနကပြောသွားတဲ့မျိုးသားကျန်းမာရေးမူဝါဒရဲ့အောက်မှာ National Strategic Plan for Maternal and Reproductive Health ဆိုတာကျမတို့အနည်းနဲ့ဆွဲပြီးတော့တကယ် universal coverage ရအောင်ပေါ့နော်ကျမတို့ဒီ accessibility ဒီ affordability နဲ့ equity ပေါ်မှာအခြေခံပြီးတော့မိခင်တွေရဲ့ရောကလေးတွေအတွက်ရောကျန်းမာရေးအတွက်ပါကျမတို့ဆောင်ရွက်နေပါတယ်အဲ့တော့ဒီ service delivery မှာတော့ဒီကကျန်းမာရေးဝန်ကြီးဌာနရဲ့အောက်မှာအခုဆိုကျမတို့ Department of Public Health ရှိပါမယ် Department of Public Health ရဲ့အောက်မှာကျမတို့မှာပြည်နယ်တိုင်းဒေသကြီးရဲ့ပြည်နယ်တိုင်းဒေသကြီးဒီကျန်းမာရေးဝန်ကြီးဌာနတွေရှိပါတယ်ဒီပြည်နယ်တိုင်းဒေသကြီးကျန်းမာရေးဦးစီးဌာနတွေအောက်မှာကျမတို့ကမြို့နယ်ပြည်ကျန်းမာရေးဦးစီးဌာနတွေရှိပါတယ်။အဲဒီရဲ့အောက်မှာမှတခါကျမတို့မှာဒီကျေးလက်ကျန်းမာရေးဌာနကျေးလက်ကျန်းမာရေးဌာနခွဲဟိုအောက်ခြေ grassroots အထိပေါ့နော်။ပြီးတဲ့ service တွေမှာမတန်းတဲ့ခြားက get priority issue ကကျမတို့ဒီဘက်ကကျေးလက်ကျန်းမာရေးဌာနခွဲတွေမှာဆိုတာဝန်ချထားတာကတပ်ဖတ်ဆရာမတွေဖြစ်ပါတယ်။အဲ့တော့တပ်ဖတ်ဆရာမတွေနဲ့အဲ့မှာတာဝန်ချထားတဲ့ကျန်းမာရေးကြီးကြပ်အဆင့်နှစ်တွေကသူ့ရဲ့အပိုင်း area ထဲမှာရှိတဲ့မိခင်တွေနဲ့ကလေးတွေကျန်းမာရေးကိုဥစားပေးဆောင်ရွက်နေရဖြစ်ပါတယ်
။အခုဗမာပြည်လောလောဆယ်မှာကျွန်တော်တို့ဒီ SDD ဟာလား AID ရဲ့ HIV ရောဂါဖြစ်တော့ဆိုရင် 2% ရှိတယ်လို့ကျွန်တော်သိရပါတယ်။အဲ့တော့ရင်အဲ့ဒီအားနဲ့ပတ်သက်ပြီးတော့ကျွန်တော်တို့ဒီ treatment တွေဘယ်လိုများပေးနေပါလဲ။ဒါမှမဟုတ် preventive measure တွေဘာတွေများလုပ်နေလဲဆိုတော့သိပြရခင်ဗျာ
။အဲ့ဒီHIV နဲ့လေ STI နဲ့ပတ်သက်တဲ့ကူးစက်ရောဂါတိုက်ဖျက်ရေးတွေကတော့ကျွန်တော်တို့တခြားဌာနတခုရှိပါတယ်။ HIV ဌာနပေါ့နော် HIV ဌာနခွဲဆိုပြီးတော့တက်ရှိပါတယ်။
National AIDS Prevention
ဟုတ်ကဲ့အဲ့ဒီဌာနဆိုရင်ပို့ပြီးတော့တခြားသိပါလိမ့်မယ်ဒီလိုကုသမှုတွေရခိုင်နှုန်းနေနေလေ။ဒါပေမဲ့ကျွန်တော်တို့ဌာနဘက်မှာကြတော့ဒီအမေကနေကလေးကို syphilis ရောဂါကာကွယ်ရေးအတွက်ဆိုပြီးတော့လုပ်နေတဲ့ project တော့ရှိပါတယ်။အဲ့ဒါကြတော့prevention of maternal to child ပေါ့နော် syphilis ရောဂါကိုကာကွယ်တာနောက်ပြီးတော့ PMCT ပေါ့ဒီခုန HIV ကိုမိခင်ကနေတတိသားကိုကူးစက်တာကာကွယ်တာအဲ့ဒါတွေကတော့ HIV ဌာနနဲ့ကျမတို့မျိုးဆက်ပွားကျန်းမာရေးဌာနနဲ့ပေါင်းလုပ်ပါတယ်
ဒီဘက်ကဒီ NAP ရဲ့ကျန်းမာရေးဝန်ကြီးဌာနရဲ့ MRA section ရဲ့ပေါင်းပြီးတော့ခုနပြောတဲ့ဒီ prevention of mother to child transmission of HIV AIDS ပေါ့နော် PMCT program နဲ့နောက်တစ်ခုကျမတို့စပြီး implement လုပ်နေတဲ့ဒီ congenital syphilis prevention ပေါ့နော်အဲ့ဒါတွေကျမတို့လုပ်နေတာရှိပါတယ်အဲ့တော့percentage အနေနဲ့တိတိကျကျပေါ်တဲ့တိုင်းကြီးကျမတို့ပြောဖို့ခက်ပေမဲ့လုပ်တဲ့လုပ်ငန်းတွေကတော့ဒီလိုပဲကျန်းမာရေးဝန်ကြီးဌာနရဲ့ခံမှုအောက်မှာပဲကျမတို့က NAP ရောဒီက MRH ရော Child Development Center ကိုပေါင်းပြီးတော့ဒါတွေအတွက်ကျမတို့ဆောင်ရွက်နေတာပါ
အဲ့ဒီလိုဆောင်ရွက်တဲ့နေရာမှာကျွန်တော်တို့ပေါ့လေဒီဘယ်လိုအခက်အခဲရှိတယ်လဲနောက်မလို့ဆရာဝန်တွေရပေါ့လေဒီမြို့နယ်ကြီးရွာတွေမှာရောက်ရှိနေပါပြီလားဒါမှမဟုတ်ရှင်လဲကျွန်တော်တို့ဘယ်လိုဟိုလေကျွန်တော်တို့ဒီဩစတြေးလျနိုင်ငံအနေနဲ့ပေါ့လေဟိုအကူအညီပေးမယ်ဆိုလို့ရှိရင်ပေါ့လေဘယ်လိုများပုံမှုထိအောင်လဲဥပမာပြင်စေဝါဆိုင်ရာတွေနောက်ဒီမှုဝါဒတွေမှာပေါ့လေတိုးချက်ပြီးလုပ်နေအောင်ဘယ်လိုများလုပ်နေလဲလို့ပြင်လာလိုက်ခင်ဗျာ
ဟုတ်ကဲ့အခုကျမတို့စီမှာကလူရင်းအားပေါ့နော်လူရင်းအားမလုံလောက်ဘူးပေါ့ man power shortage ကရှိနေပါတယ် level တိုင်းမှာပဲကျမတို့ဒီဘကိုအဆင့်မှာရောပြည်နယ်တိုင်းအဆင့်ရောတောင်းရှိပါအောင်ဒါတွေကဒီ man power shortage အဲ့ဒါတော့ကျမ မတို့ကြုံတွေ့ရတဲ့အခက်အခဲတွေတခုပေါ့။နောက်အခုဒီပွင့်လင်းမြင်သာဖြစ်လာတဲ့ဒီအစိုးရပြည်လက်ထက်နောက်ပိုင်းမှာလည်းအခုလို scholarship တွေ program တွေတွတ်တက်ကြတဲ့generation ကများလာပါတယ်။များလာတဲ့အခါမှာကျမတို့ဒီရုံးမှာရောနောက်အစီအတိုင်းမှာရောရှိတဲ့လူရင်းအားနေပေါ့နော်ဒီအလုပ်ကိုတော်တော်လေးကိုနိုင်မနေလောက်ရမှာရှိပါတယ်အဲ့ဒါကြောင့်မလို့အခုအကြီးဆုံးခက်ခဲရတော့အဲ့ဒီ health manpower shortage ပါ
အဲ့တော့ manpower shortage ရဲ့နောက် budget အနေထားရောဘယ်လိုရှိပါလဲ budget ကတိတ်ပြီးနေနေတာပို့ပြီးလိုအပ်နေပါ
ဟုတ်ကဲ့အခုအဲ့ health expenditure ကကျမတို့ရှင်းထက်တော့တိုးလာပါ
ကျမတို့ကျမရေးဝန်ကြီးဌာနရဲ့ဒီ expenditure ဒီကျမဝန်ကြီးဌာနရဲ့ budget ကပါเนาะကျမတို့အရင်ကအများကြီးတိုးပြီးရပါတယ်အဲ့ဒီ health service delivery point မှာလည်းအများကြီးအထောက်အကူပြုလို့ public health မှာလည်းအထောက်အကူပြုလို့ဒီဘက်က medical care ပေါ့เนาะ medical therapy ဘက်မှာလည်းအများကြီးတိုးတက်လာပါတယ်ကျမတို့တချို့ essential medicine တွေတော်တော်များများအကုန်လုံး free issue ပေးနိုင်တာရှိပါတယ်အဲ့ဒီခါမှာဒီဘက်စေယုံစင်ကနေမှာဆိုလို့ရှိရင်patient attendance rate တွေတက်လာတာပေါ့နော်လူတွေကစေယုံစင်ကန်ကိုအားကိုးလို့စိတ်ကြီးများလာတယ်ပိုလာတယ်ဒါတွေကတော့လက်ရှိကျမတို့တိုးတက်လာတဲ့ကောင်းကျိုးတွေအများကြီးပါအဲ့တော့ခုနဆရာမေရဲ့အောက်ခြေအထိကြေးရွာထိဆရာဝန်ရှိပြီလားဆိုတာတော့ကျမပြောပြတဲ့ဖွဲ့စည်းပုံလေးပြန်ပြောပြရမယ်ထင်ပါတယ်ဘာဖြစ်လို့လဲဆိုတော့ကျမတို့ရဲ့ဒီဘက် health service တွေဖွဲ့စည်းပုံမှာအနေဆုံးဒီကျေးလက်ကျန်းမာရေးဌာနဝဲပေါ့ Separate Health Center ပေါ့အဲ့တော့ Separate Health Center က mainly run by midwife ပေါ့ဆရာ။ဟုတ်ကဲ့ RAC ဒီဘက်က Rural Health Center ကျတော့ Health Assistant run လုပ်ပါတယ်။အဲ့တော့ဆရာဝန်ဒီမြို့နယ်ဆေးရုံမှာရှိပါမယ်။တိုက်နယ်ဆေးရုံ Station Hospital မှာရှိပါမယ်။ဒါပေမဲ့တချို့ RAC တွေမှာဆရာဝန်တွေခန့်ထားတာရှိနေပါပြီ။ဟုတ်ကဲ့ပါ။ဒါတော့ဒီဘက်ကဝန်ကြီးဌာနရဲ့
နောက်ပြီးတော့ကုသမှုဆိုင်ရာမှာတော့ဒီဆေးဝါးပေါ့လေအပြည့်ပေါ့လေသူတို့ပေးနေပါပြီလား။ဒါမှမဟုတ်ရှင်ဘယ်လိုဟာတွေလိုအပ်နေပါလဲ။
ကုသမှုပိုင်းမှာတော့ကျမတို့ကဒီလိုပါပေါ့နော်အပြေးဝပေးနိုင်တယ်လို့လည်းပြောဖို့တော့ခက်ပါတယ်ဒါပေမဲ့ဒီကပြောတဲ့အခြေခံလိုအပ်ချက်
ကတော့ကျမတို့ပေးနိုင်ပါတယ်စေယုံနဲ့အခုမှဆိုတော့ကျမတို့စေယုံနေမှာ every delivery ကိုကျမတို့ free delivery အတွက်အမျိုးသမီးတွေရောက်ပြီးကုန်ကျစရိတ်မရှိတော့ဘူးပေါ့နော် free ဆေးဝါး free ပေးနိုင်ပါတယ်ဒါတော့ patient ရဲ့ living cost ကတော့ဒါတက်ပေါ့နော်ဆရာကပြောတဲ့ treatment ပိုင်းဆိုင်ရာမှာဆေးဝါးတွေအရင်လိုဝယ်ယူရတာမျိုးမရှိတော့အကုန်လုံး free ပေးနိုင်ပါတယ်
အဲ့တော့ဒီ season လာပြီးတော့လေးလာစီးပူးခြင်းအပြင်ပေါ့လေပမာနိုင်ငံမှာဘယ်လိုများအထူးပြုနိုင်မှာလဲနောက်ပြီးတော့ဘယ်လိုများဆက်ပြီးတော့ဒီအစီအစဉ်နဲ့ဆက်လုပ်နေလဲဆိုတာလည်းသိရရင်
ခုနဆေးဝါးကြောင်းလေးတစ်ဆက်ပဲပြောရင်လေနည်းနည်းထူးခြားတာကျမတို့ဒီသားဆက်ချဆေးဝါးတွေပေါ့အရင်ကဆိုသားဆက်ချဆေးဝါးတွေကဒီအစိုးရဘတ်ဂျက်နဲ့မဝယ်နိုင်ခဲ့ဘူးပေါ့အဲကျမတို့ဒီ2017-12ဘတ်ဂျက်မှာကျမတို့ကစပြီးဝယ်နိုင်ခဲ့တယ်ဒါပေမဲ့အမျိုးအစားအားလုံးမစုံနေမဲ့လေထိုးဆေးနဲ့တောက်ဆေးပေါ့အဲ့ဒါကိုကျမတို့ဗာလဲအားလုံးကိုဖြန့်နိုင်လောက်တဲ့အထိပေါ့ခုနကျန်းမာရေးဌာနတွေအားလုံးကိုဖြန့်နိုင်တဲ့အထိကိုဝယ်နိုင်ခဲ့ပါတယ်အဲ့တော့အဲ့ဒါလေးကတော့ထူးခြားလာတာပေါ့နော်
တကယ်ကိုတိုးတက်မှုပါ
government budget line မှာပါလာတာပေါ့အဲ့ဒါကတော့ကျမတို့အရင်ခေတ်ကတခါမှမရဘူးခဲ့တဲ့ဒီမျိုးဆက်ပွားကျန်းမာရေးနဲ့ပတ်သက်တဲ့စီးပွားတွေဟာအခု2012နောက်ပိုင်းမှာတချို့ပေါ့နော် essential medicine ကိုဝယ်နိုင်လာတယ်မိခင်တွေအတွက်ခုနလိုပြောတဲ့ကျမတို့အရေးပေါ်တွေမှာလိုအပ်တယ်လေ misoprostol လိုမျိုးနောက်ပြီး magnesium sulfate လိုမျိုးနောက်ခုနသားသက်ချစီးပွားတွေအဲ့ဒါတွေ government budget ကိုဝယ်နိုင်တာလေပေါ့
အဲ့တော့လုံးနဲ့ပေးနိုင်ပါတယ်
အဲ့တော့ကျွန်တော်နောက်ဆုံးအနေနဲ့မြင်တာဒီပေါ်လေးဒီတပြည်လုံးအနေထားနဲ့ကျန်းမာရေးထုတ်တဲ့အောင်ကျန်းမာရေးပညာရေးလုပ်ငန်းတွေပေါ့လေပုံမှုတိုးချက်ပြီးတော့ဆောင်ရွက်နေတဲ့အခြေအနေကိုသိရတယ်ခင်ဗျာ
အဲ့ဒါကျမတို့ဒီကျန်းမာရေးနဲ့ပတ်သက်ပြီးအခုဆိုရင်ဒီလိုမျိုးပေါ့နော် father program တွေဒီခုလိုမျိုး intensive short course တွေကျမတို့တိတိတတ်တာကိုပို့ပြီးတော့အားပေးလာတယ်လွှတ်လာတယ်နောက်ပြီးတော့ခုလိုဒီဘက်မှာတိုးတက်ပြီးသားနိုင်ငံတွေရဲ့အတွေ့အကြုံတွေယူဖို့ကျမတို့ခွင့်လန်းနေရလာတယ်အဲ့တော့ဒီဘက်မှာတိုးတက်ပြီးတဲ့နိုင်ငံတွေရဲ့အတွေ့အကြုံတွေကျမတို့ကဒါယူပြီးတော့ကိုယ့်နိုင်ငံမှာဘယ်လိုပြန်ပြီးတော့support လုပ်နိုင်လဲဆိုတာကျမတို့အဲ့ဒါတွေကိုအခုဒီမှာတင်ရင်းနဲ့ကျမတို့ဆွေးနွေးကြမှာဖြစ်ပါတယ်
အဲ့တော့ဒီပြည်သူလူထုအကျန်းမာရေးပညာပေးနေတဲ့ဆိုတဲ့ဟာပေါ့လေအခုဆိုလို့ရှိရင်ကျမတို့မှာကျန်းမာပညာဌာနဆိုတာအရင်ကတည်းကရှိပါတယ်ဒါပေမဲ့အခုဒီနှစ်ပိုင်းကစပြီးတော့ဒီကျန်းမာပညာဌာနကို director level အဆင့် director level နဲ့ထားပြီးတဲ့အခါမှာဒီကျန်းမာပညာ health education bureau ပေါ့နော်အဲ့ဒါနဲ့ဒီ central level ပြည်နယ်တိုင်း level ပေါ့နော်အဆင့်ဆင့်ကိုစနစ်တကျဆောင်ရွက်နေတာရှိပါပြီဟုတ်ကဲ့ပါ
အဲ့တော့နောက်တစ်ခုကျွန်တော်ဗလေဒါတော့ဒီဆရာမကြီးတို့မေးချင်တာဒီအစားအသောက်နဲ့ပတ်သက်တဲ့ infection ဖြစ်တဲ့ကိစ္စတွေမှာဗလေအစားအသောက်နဲ့ပတ်သက်ပြီးတော့ဘယ်လိုများဗလေစီမံကပ်မျိုးကိုကင်းနေစားဖြစ်ကြစေ
အဲ့ဒီတော့ကတော့ FDA ရှိပါတယ်နော်
အကျဉ်းချင်းပြောရရင်တော့ပေါ့နော် ပေါ့ဒီကျမတို့မှာအခုအမျိုးသားအစားတောင်းတဲ့ဆေးဝါးကွက်ကဲအာဏာပိုင်အဖွဲ့ဆိုတာရှိပါတယ်ကျမတို့ကျန်းမာရေးဝန်ကြီး Food and Drug Administration ပေါ့နော်အဲ့တော့ Food and Drug Administration ဒီဦးစီးဌာနတစ်ခုအနေနဲ့လည်းတည်တံ့ရှိပါတယ်ပြီးတော့သက်ဆိုင်ရာပြည်နယ်တိုင်းတွေမှာလည်းဦးစီးဌာနတွေရှိတယ်လို့သက်ဆိုင်ရာပြည်နယ်တိုင်းမြို့နယ်အဆင့်ကြီးကိုသူတို့ Food and Drug Advisory Supervisory Committee ဆိုတာရှိပါတယ်ဌာနဆိုင်ရာပေါင်းစုံပါဝင်ပြီးတော့ supervise လုပ်ကြတာပေါ့နော်အဲ့လိုမျိုးဖွဲ့ထားတာရှိပါတယ်မြို့နယ်တွေမှာလည်းတော်တော်လေးအသက်ဝင်ပါတယ်ဒါကျမလက်လှမ်းမိတယ်လို့ပြောကျမတို့ knowledge ရှိတယ်လို့ပေါ့နော်ဒီဘက်မှာ
ဟုတ်ကဲ့ခင်ဗျာအခုလိုပါလေစိတ်ရှိလို့ရှင်းပြရတဲ့ဆီယမတော်ဆန်နဲ့ဒေါက်တာတင်ကျေးဇူးတင်ပါတယ်ခင်ဗျာ
ဟုတ်ကဲ့ပါရှင်
ကျေးဇူးတင်ပါတယ်
Thank you
Still waiting for
Wonderful. Welcome. You two met when Professor Reproductive went to Yangon.
At the time I was in the University of Ghana.
Yes, that's right. And he's got promoted to be director of the University of Ghana.
Congratulations. That's wonderful. You bring a lot of good changes.
And what's wonderful is that we have close
It's lovely to have you here. Welcome.
You're selfish. I'll tell you what later.
Introduce you to
Oh, Celine, thank you. Yes, welcome. You're very special friends to us. You're probably parents and grandparents to our boys in the world.
To the war.
very busy for tourists to spend our sexual education.
That's wonderful.
Fantastic.
And then you're friends for life when your children and it'll go on this bond. It's wonderful.
May I invite you to come and live some
Beautiful. And it's wonderful to be able to, even though I haven't been governor for a few months, I said I'd finish at the anniversary of World War II and we should put a soldier there. But I can tell you I can never forget the beauty and the goodness of the people of Myanmar. The people of Burma, it was them, to Australians in those terrible years. Wonderful. Brings tears to my eyes.
And we have our Ministry of Health.
Yes, wonderful. Well, we'll be grateful. This will even make the friendship more strong and enduring. It's wonderful. Thank you.
BMB နဲ့ခါအားရတယ်တက်ပြီးတော့ဒီကပြန်တော့ဆရာပြီးတော့ service medical association ဆက်ပြီးရတယ်ဆိုတော့ကျွန်တော်ဒီမှာကျွန်တော်တို့ပတ်ကြောင်းဆက်တယ်ဟုတ်ကဲ့အဲ့ဒါတို့ကတော့ဆရာတော်ရွှေဟုတ်လားဆရာနာမည်ကကြားဘူးလေသူပြောပြတာ
Good afternoon. Professor the Honourable Dame Mari Bashir, distinguished guests, friends, colleagues, welcome to Sydney University. My name is Kirsty Foster and I am the Associate Dean International for Sydney Medical School, and I'm also an Associate Professor in Medical Education at the University of Sydney. At the start of this important and exciting event, I'd like to acknowledge and pay respect to the traditional owners of the land on which we meet, the Gadigal people of the Eora Nation. It's on their ancestral lands that the University of Sydney is built. As we share our own knowledge, teaching, learning and research practices within this university, may we also pay respect to the knowledge embedded forever within the Aboriginal custodianship of country. It is my enormous pleasure to welcome you all, particularly all of you from Myanmar who've travelled yesterday and those who travelled some weeks ago, to Australia's oldest university, the University of Sydney, and in particular to Australia's oldest, first and of course finest medical school, to participate in this ceremony this afternoon. Sydney Medical School is delighted to welcome 25 Australian Awards Fellows from Myanmar who are here for the intensive sexual and reproductive health development programme for Myanmar, funded through round 15 of DFAT's Australia Awards Fellowship Programme. I'm also delighted that the fellows from our joint AAF programme with the University of Adelaide, who are in Sydney for 12 weeks, are studying at our clinical schools, are also able to join us today. I was fortunate to visit your beautiful country last year with Professor Glenn Salkeld and Professor Bob Cumming, who are head and deputy head of our School of Public Health, and Bob's here today. And it's lovely to see some of the people that we met on that visit here in Sydney. Through the Office for Global Health, we are delighted to have the opportunity to strengthen the links we have with your institutions. Myanmar is a Tier 1 priority country for Sydney Medical School, and we have several staff engaged in collaborative education and research initiatives there, including the National Institute of Maternal and Child Health, established in November 2013, with support from Dr. Tin Tin Tay, the Deputy Health Minister. This is a good moment to introduce Professor Bruce Robinson, Dean of the Sydney Medical School, who signed the agreement for the National Institute of Maternal and Child Health Medicine in the presence of Dr. Mari Bashir in November 2013. And Professor Robinson is going to briefly outline Sydney Medical School involvement in Myanmar. So, welcome.
So thank you, Kirsty, and a very warm welcome on this cold winter's day to all our colleagues from Myanmar. It's especially a great pleasure to see so many of you here and so many of you dressed in your national dress as well. As Kirsty said, Sydney Medical School started to develop its relationship in Myanmar now a few years ago. Initially, as we opened the Institute for Maternal and Child Health that Kirsty has already spoken about. But since then, there have in fact been many people from our medical school who have been to Myanmar. We've had many of our colleagues from Myanmar who have been here to visit us. And in no particular order, there are a number of specific projects that are being undertaken at the moment. One of these is through the Australian Consortium for Health in Myanmar, which is very much a partnership with us and the University of Adelaide. And Bob Cumming, who's sitting over here, is actually one of our people from the University of Sydney who's involved in that project, which is trying to deal with snakebite in Myanmar. And this project has also received significant support from the Faculty of Science here in the University of Sydney. As you know, the Russell's viper, which bites people in Myanmar, is slightly different to the Russell's viper that bites people in Thailand. So the anti-venom which is currently used in Myanmar is unfortunately not as effective as what it might be. And the aim of this project is to actually develop a better and more successful anti-venom. Also in conjunction with the University of Adelaide, we have a number of fellows, some of whom are here at the moment, who are visiting us for clinical and educational experiences. And then, of course, very importantly, we have the group of people who are here for the maternal and child health or the sexual health project, which Shalendra and Kirsten are leading here from the medical school. This is a project which I'm sure will contribute enormously to improving the sexual health of the people in Myanmar. I know when we were in Myanmar, we did visit several sexual health clinics, and I think it shows great foresight on the part of the government of Myanmar to be focusing in this area, because the sexual health of your young people particularly is one of the factors which will contribute to the growth of a healthy and prosperous nation. There are a number of other research projects and education projects that specific people in the faculty are undertaking. Again, Glenn Salkeld, who's just arrived as head of our School of Public Health, has been very supportive of the initiatives that we'll be undertaking in public health. Gerard Sutton from the Sydney Eye Hospital has been very involved in dealing with problems of eye disease in Myanmar, and there are a number of others. Also very importantly, we've developed a very good exchange program with several of the universities in Myanmar. The University of Magway is the first one where this has actually come to fruition, where some of our medical students exchange places with some of your medical students to gain clinical experiences. And those clinical experiences, we know from talking to our students, and certainly I think from talking to your students, the students find these experiences particularly formative. It's something that's that sticks in their mind for whatever area of medicine they subsequently decide to pursue. We're hoping to, and we've signed a memoranda of understanding with the universities in 1 and 2 in Yangon, University of Mandalay, University of Magway, and also the University of Public Health for similar types of student exchanges, because the development of friendships and educational bonds between people at a very young age, we believe very firmly here at Sydney, is one of the things that helps build a strong and enduring relationship between two countries, and in this case between Australia and Myanmar. I've got to say, one of the things that has been most valuable, I think, in terms of our relationship with universities in Myanmar has been the partnership that has actually helped forge between the University of Sydney and the University of Adelaide. And particularly for Rhonda, who is here from the Department of Foreign Affairs and Trade, this is something that through the group of 8 universities we've really been trying to foster. But rather than having relationships with a number of universities, is actually much more appropriate and cost effective that some of the good universities in Australia work together to try to partner and then develop partnerships in country as a group rather than as individual universities. So I wish all of you a very successful stay here. I do hope you learn lots of things that will help you in your future careers. I know from talking to Shalendra and Kirsten that they expect to learn a lot from you. We always know that it works that way, that we learn just as much from you as we are able to teach you. So thank you very much for honouring us by coming to study here at the University of Sydney, and I look forward to catching up with some of you during the time you're here, or if not, back in Myanmar. Thank you.
Thanks very much, Bruce. As Bruce said, we are very honoured that Ms. Rhonda Pigott from the Department of Foreign Affairs and Trade is here today. She is the Director of the New South Wales State Office of the Department of DFAT, Department of Foreign Affairs and Trade, and responsible for managing DFAT's engagement with the state government, business, regional authorities, academia, and community groups, and the Consular Corps, one of the largest in the world. Rhonda, would you like to address this? Yes, thank you.
Well, thank you very much for having me here this afternoon. I'm delighted to be here. I've been in my position here in Sydney for only 1 month, and so it's fantastic to see a group of Australia Award Fellows here at the university, and such a large number of you. It's terrific. So firstly, can I just say welcome to Australia on behalf of the Department of Foreign Affairs and Trade. And congratulations to each of you for being selected to participate in the program. The awards are the Australian Government's International Scholarships and Fellowships program, and offer a unique experience to scholars and fellows from all around the globe. Just last week I participated in a separate Australia Awards event at which there were 200 international students coming to study in Sydney and in other parts of New South Wales. But all up, there are about 4,000 students in Australia on Australian awards. And these are fantastic opportunities to partner with organisations here in Australia, and as the professors were saying, for us to partner with your organisations to share and exchange information, and very importantly to build the people-to-people links that we hope you develop here during your stay and you take home with you. It's very much a commitment on our part that we like to continue those links, not just while you're here, but when you go home. In this way, we build up really good relationships and partnerships to the benefit of everybody who's participated. So I mentioned that the Australia Awards are for international students coming to Australia. The Australian government also has scholarship programs for Australian students going to other universities overseas. and that's a fairly new program that the government has started called the New Colombo Plan, and the focus of that is quite particularly in the Asia Pacific region. So the Australia Awards program that you're part of is much older and bigger, but we recognise that it's a two-way benefit, and it's very good for Australian students to be going out and studying in the Asia Pacific region as well. So altogether, it's a way that the government sees, as I've said, of building up those people-to-people links, which when you come down to it, that's what international relationships are all about. We very much encourage you to, in your stay here, to not just work hard, but have some fun. And when you go home, take those fond memories of Australia with you, and as I mentioned, those professional links as well. Thank you, and good luck in your time here.
Thanks very much, Rhonda. Okay, well, as you know, Associate Professor Kirsten Black is one of the course organisers here. She's also one of the, she is the joint head of the Department of the Discipline of Obstetrics, Gynecology and Neonatology within Sydney Medical School. And Kirsten is going to give you a bit of an introduction to reproductive health at the University of Sydney.
Thank you. Okay, welcome. We're going to try a little bit of Burmese. Mengala Nilagin. Okay, so welcome on behalf of the discipline of obstetrics, gynecology and neonatology. Our discipline has a national and international focus and is involved in many projects covering maternal fetal medicine, gynecology, reproductive health and contraception. And my own passion has always been supporting women's access to contraception, to choice, to different choices, and allowing them to elect when or whether to have a child. Indeed, it is estimated that globally 225 million women who want to avoid pregnancy are not using an effective method of contraception. And this results in millions of unintended pregnancies. Even in Australia, it's estimated that about half of all pregnancies are unplanned. And based on US data, probably about 40% of those end in abortion. Women who continue with their pregnancy may have their education or career curtailed. For the family, there are financial implications for raising a child. However, the consequences of unintended pregnancy are much more grave in low-resource settings, with unsafe abortion, lack of ability to control family size and birth spacing, contributing significantly to maternal mortality and morbidity, as well as impacting on neonatal health and child health. If the world were able to provide reliable contraception to all women who want to avoid a pregnancy, it has been estimated that unintended pregnancies will drop by 70%, from 74 million to 22 million. Maternal deaths will drop by 67%. Newborn deaths will drop by 77%. The burden of disability related to pregnancy and delivery experienced by women and newborns would drop by 2/3. And transmission of HIV from mothers to newborns would be nearly eliminated. But not only does family planning save lives, it is one of the most cost-effective interventions. In our Pacific neighbours, for example, it is estimated that for every $1 that is spent by 2020 to reduce the unmet need for family planning, around $10 to $15 would be saved in health and education expenditure. This would make other development goals more attainable and more affordable. The Working Group proposal for Sustainable Development Goals, which builds on the agenda of the Millennium Development Goals, recognises the importance of ensuring universal access to sexual and reproductive health, with a particular focus on family planning and expanding community education. The proposal also emphasises the importance of integrating reproductive health into national strategies and programs. My colleagues and I are very much looking forward to meeting and working with you all over the next few weeks to assist in your development of strategies to address the reproductive health challenges in Myanmar. Thank you.
So, no pressure then. A lot to do, a very important topic, which is why you're all here. And just around because many of you, as we heard this morning in the session this morning, work in public health and policy, and clearly that's going to be part of what you are working towards, as Kirsten says. So what better time to introduce Professor Andrew Wilson from the Menzies Centre for Health Policy to talk a little bit about its role, because as you know, Anne-Marie now is one of the course organisers who unfortunately is sick today.
Thank you. And welcome. Thank you very much for giving me 5 minutes to talk to you. Professor Dame Mari Bashir, distinguished guests and new colleagues from Myanmar, welcome. As I walked over here this afternoon in our chilly day, I was reminded that 30 years ago I grew up in North Queensland, which has a temperature which is much more similar to your own in Myanmar. And 30 years ago I hopped on a plane, flew to the US and hopped out in the middle of the Colorado winter. So I felt for you today, for those of you who arrived yesterday, as you experienced that dramatic change in climate. But I hope that the dramatic change that you will actually feel will be a learning experience in these 10 days, and for those of you here for the other courses and longer periods of time, an opportunity to think differently and to think a little bit outside of the usual constraints in which you currently work. The Menzies Centre for Health Policy is a small group that links a range of people across the university, particularly across the School of Medicine, focusing on issues of health policy. And what do I mean by this? I mean thinking about the ways that we can construct environments, construct ways that help us disseminate and practice better healthcare more broadly. And that includes better ways of funding our healthcare, better ways of organising it, and better ways of preparing people for it. And I would hope that the time that you have here will help you develop and think about the clinical practice and the clinical skills, and that when you go back you will have an opportunity, at least some of you, to reflect that and to model that for the people you work with. But more importantly, what we would hope that in this period of time is that you'll be able to think about that and think about how you might actually change some of the other parameters around which will bring about that broader change in practice, which will have the broader population health impacts that I'm sure you're responding to. Now, I'm always very conscious when I'm talking to a group such as yourselves that our countries are very different, our resources are much more different when we come to try and apply them to different problems. Tomorrow I'll chair for the first time the Pharmaceutical Benefits Advisory Committee, the key committee in this country which recommends what drugs this company subsidises in its medical programs. The last time this group met, it made recommendations which will cost this government $1.5 billion in drugs to treat hepatitis C alone. So if you think about that for your own, and you think about the size of your health budget, clearly there are very vast differences in terms of the resources that you have available to us. But I think underlying those decisions there are some very broad principles which are the same, and they're principles around the safety of practice, around effectiveness of practice, and particularly the cost effectiveness of practice, and importantly the appropriateness of that practice for the environments in which we work. And those principles are the same whether you're talking about health policy in Australia or whether you're talking about health policy in Myanmar. I've had the privilege of teaching with some of your colleagues. You see at the back there has been sitting in our unit and working in our unit, so that's been a privilege. I've also had a number of students within our health policy program, and that's given me a sense of some of the complexity that you're trying to deal with in Myanmar, some of the problems of trying to implement what are relatively straightforward health policies from our perspective into that complex environment and resource-challenged environments that you are. What I hope we can do is get you to think a little bit more about that, and I know Anne-Marie has a lot of experience in this. We'll be doing that, trying to get you to think about different ways of doing things, different ways of using resources in a way which will achieve the ends that you will hear about and see when it comes to reproductive health and sexual health as it's practiced in Australia. So thank you and welcome, and I hope this is an enjoyable time for you.
So I'd now like to invite Dr. Shailendra Silshwakar to the floor. We were hoping to welcome Professor David Lewis from the Western Sydney Sexual Health Centre, but unfortunately he is not well today, and he was trying to come but couldn't quite stagger from his sick bed, so we thought that was probably wise. So Shailendra is going to tell you a little bit about the work of the Western Sydney Sexual Health Centre and also outline the programme briefly. Thanks, Shailendra.
Good afternoon, everyone, and welcome to Sydney. It's a pleasure to meet you this morning. Now, first of all, I would like to convey the message from David and Professor Tanya Sorrell, who welcome you as well. Both couldn't be here to welcome you in person today. They've sent an apology and welcome as well. So I work at Western Sydney Sexual Health Centre, which is a combined unit of clinical, educational and research together, which was formed about 2 years ago by amalgamating different entities. There was a clinical service running since 1979 in Parramatta. And there was an academic unit based at Westmead, and those two units came together to form a service which was giving both academic and clinical services at the same time, which I think is something that we all would like to do, joint academic and service delivery issues. The centre also runs a master's program. One of the master's programs has been running for about 25 years now in HIV/ST and sexual health. There are not many master's programs focusing on this area in the world, and we are proud to have that program running for so many years. It does cater to different needs. So HIV obviously is something that touches every aspect of health, starting from public health to counselling. What we have in this master's program is a pathway for every professional, for a doctor to do clinical medicine, for a nurse to do nursing stream, for a lab person to do lab pathway, for a public health person to have a public health pathway, and for a counsellor to have a counselling pathway. It is a small program, but nonetheless it tries to cater to the needs of various different disciplines. We also have excellent relationships with other partners in the City of Sydney as well. So we work very closely with W Planning New South Wales, with also other universities, to note again with Kirby Institute at the University of New South Wales. We work very closely with them. And with also colleagues from this own university. So we work closely with business school people who teach marketing. And you would wonder as to why do we work with people in Sydney Business School. It's interesting because health nowadays is seen as consumer behavior issue as well. So when we talk about access, it's also to do with why would someone want to access a service which is not welcoming them. And HIV obviously taught us that, saying we need to have a service which is welcoming to everyone. Roger is here. Roger has been instrumental in helping us in the HIV program for a number of years now. A few years ago, when we were running the masters, we realized that not everyone can spend a whole year to come and do masters here. And we designed a short program for about 10 to 12 weeks. We call it a Global Intensive Professional Program in HIV. It ran for the last 5 or 6 years, since 2010, supported by DFAT. Thank you for that. We trained about 100 people in the last 5 years from 11 different countries. And there were people from Myanmar, Indonesia, Cambodia, Zambia, Zimbabwe, Botswana, Tanzania. So a number of different countries, and we put them together. And that was an experience to put a teacher from Botswana with a health policy maker from Zambia to a doctor from Cambodia and learn a lot about HIV/STIs. And this is a different experience again. And for this program, we partner obviously with subject experts in reproductive health, with Kirsten Black, and health policy experts from Mendes Institute of Health Policy. and a lot of other guest speakers who will come and talk about the program. So now I'm going to talk about the program. The program is a very, very short and intensive, as some of you will see in the next 9.5 days, is that there's a lot to do. There's a lot to cover in those 9 days. We're going to try and do mental health programs, including the young people, adolescent health policy development and its implementation, what are the challenges there. We're going to talk about family planning, as an important issue, as Kirsten has already mentioned. And obviously, close to my heart is STIs and HIV, so we'll talk about STIs and HIV a lot. There are other things which are cross-cutting in nature, things like gender, things like culture, and how that impacts services in sexual and reproductive health, and we'll talk about those as well. But we're going to start off with mapping activities, which will basically try and get you to tell us what works in Myanmar, what doesn't work, how we're going to try and overcome some challenges. And across 3 themes, public health is one theme, service delivery, clinical service delivery is another, and human resources. Because I think for effective public health responses, we need people who are trained effectively in public health, clinical services, and to understand different strategies. Now I want to talk about the 3 components of these programs. The reproductive health component, as Kirsten has said, talks about family planning, conception. We're also going to talk about cervical cancer screening, which is a largely an important area for whole of Asia, I think. And then we're going to have 2 important visits in this program, one of which is going to be the New South Wales Health Unit. And there we're going to talk about how does the health department interact with the university. Also, how does that put research into strategies. So those are few issues that we would like to deal with in that visit. And then there is a visit to family planning in New South Wales, which will look at how does an independent entity provide services, but also trains people across this country. In the STI part, we'll again have issues in terms of how STIs impact. Now, when people talk about maternal and child health, they do forget about the contribution that STIs make to improvement in reproductive health of women, and we'll try and deal with those at our center. And not last but not the least, it's about health policy, because all of this needs to feed into an effective health policy and effective public policy. So we'll try and cover that aspect as well. So there's a lot to cover in the next 9 days, and I'm sure we'll try our best to give you what we think is a good platform to share. It's not about we trying to teach you anything. I think it's going to be providing a platform for all of us to share, and at the end, come out with a plan that we can work with, not just for this program, but for some other programs in future. Thank you.
So as you can see, a huge amount of enthusiasm here, and I was very impressed to learn the work that Kirsten, Anne-Marie and Shailendra have done in preparing and organising this course, along with Sinise from the Office for Global Health's help. And I learned this morning that they've been doing that very much in collaboration with you. So it is very much a two-way street. This use the two-way analogy, but so really the course is designed to deliver really what you feel will help you most. And as we discussed this morning, the interaction that is planned into it is really important in the learning that there's going to be. Now, I would like to invite Professor Dr. Singso So, who is the acting rector of the University of Community Health, Magway, to address us.
Good afternoon, distinguished guests and ladies and gentlemen. First of all, may I introduce myself? I'm Professor Dr. Singso So, an acting rector of the University of Community Health, Magway, and it's a great pleasure for me to speak on behalf of our team on the auspicious occasion of the opening ceremony of the Intensive Professional Program in Sexual and Reproductive Health Policy Development for Myanmar Day. And I want to thank also the government for its kind arrangement of this program, and the University of Sydney for its hosting of this program, and the Department of the Foreign Affairs and Trade for its generous financial support, including all the responsible personnel here. And as you all know, the program is supported under the Rock 15 of the Australia Water Fellowship Scheme, with the aim of to enhance the capacity of the health professional to develop and implement comprehensive reproductive health policy and to improve the quality of the sexual and reproductive health services in Myanmar. Early 2015, that is the last February, we were well organized and selected by the Ministry of Health to participate in this program, and our group includes 25 members from the various health departments and institutions, and there is 6 universities under the Department of Assuring Professional Resource Development and Management, from the Department of Public Health and Medical Services, and from the State and Regional Health Departments, and some representatives, 2 local NGOs, there is the Myanmar Maternal and Child Association and Obstetrician and Gynecologist Association of the Myanmar Medical Association. According to the program outline, we'll have to learn or study the sexual and reproductive health, focusing on the policy and health services delivery and research methodology and gender issue, leadership and team management, and we will be able to discuss with each other and with an Australian expert here for about 10 days. So it is a great opportunity for us. And at the same time, it's known that we'll have to take a study visit tour to the New South Wales Ministry of Health and then Family Planning, New South Wales. By doing so, we can know the activities currently run in these 2 institutions. After attending this program, and we do hope that we will be able to share or contribute our knowledge and experience gained here to our junior teams, and we will also conduct the research work on SRGs, and finally, we can perform advocacy meeting with high authorities to establish the strong policies in line with local conditions of Myanmar. By doing so, I think the reproductive health status of our women, men, adolescents and youth will be improved or more improved than ever. And at the same time, we'll have a chance to study the social and cultural characteristics of the Australian people here by taking sightseeing, by going shopping, by eating out at the different restaurants and shops, and we can explore the regional knowledge as well. And anyway, by attending this program, we gain a lot of environmental knowledge and experiences, and with a great chance to discover the Australian expert here. In conclusion, and we do believe with no doubt that we'll achieve the aim and objectives of this program by doing the research work on the SRH to implement the policies in our country, Myanmar, and so we can serve our country in the area of SRH. So, in addition to it, I hope we can further strengthen our collaboration with the University of BCBG here. And the last but not the least, we are very, very grateful to the Ms. Naiso and Alfin, David Wines, and Sarah de BCBG for their continuous kind help throughout the preparatory period, with corresponding with us with several emails. Thank you very much.
Yes, I think one of the things about this group is the short intensive course has given an opportunity to have, because you are all very busy people at that level in your career, it's given you an opportunity to come for that time, and I already feel energized about it, that your enthusiasm that you're bringing to this program, as well as the enthusiasm of the teachers and my colleagues here who are looking forward to interacting with you. So I really feel excited about how much is going to be achieved, even in such a short time, because of the people who are involved. Now, our next speaker is very well known and loved to all of us at the University of Sydney as until recently, relatively recently, the Chancellor of our university, and also the Governor of New South Wales. And I know that she has a great love for Myanmar, and would like to say a few words to you now. So it's my real pleasure to introduce Professor the Honourable Dame Mari Bashir.
Well, truly, it's a joy and a privilege to be here with you today and to welcome our distinguished guests, our visitors. Dare I say, our sisters and brothers from Myanmar, from Burma. And it's wonderful that we have the Dean of the Faculty of Medicine with us as well. Of course, Professor Andrew Wilson. I look around, I see members of the faculty in international health, but especially to have so many of our colleagues and friends from Burma, Dr. Anne and of course Dr. Kirsty Foster. Because here in Australia, although we used to be said to live down under, we know and are proud to say we live in the Asia Pacific region and we're part of that family. And working together in medicine is one of the most inspirational things across borders, across boundaries, that I have ever experienced outside of family life. And I can never forget the visitors, the high-ranking visitors from Myanmar who came in the last 2 years and they said, can we join our talents and work together in the interests of mothers and babies? And no one could refuse to do that. And our wonderful people in health here were eager and immediately responded to that. And the joy of working together is something that can never be calculated in any way. And let me say, I'm old enough to remember as a little girl what the people of Myanmar, the people of Burma did for our Australian boys during the Japanese War, the Pacific War. They, at risk in their own lives, at risk of their own lives, they smuggled food and help to our young men who were prisoners of war in those difficult years. In fact, many of those men came back, not only to tell the story, but to go on and do amazing deeds in medicine, the doctors. One was called Dr. Weary Dunlop, became a very famous Australian for his work. And another was Dr. Frank Mills. Dr. Frank Mills came back 5 stone. How much is that in kilograms? About 40 kilograms. Just a skeleton that was still alive. However, he went to the hospital a few metres from here and was the first person to do open heart surgery in Australia and taught so many others. And by our Burmese, our Myanmar colleagues and friends saving his life, he was able to go on and also save the lives of so many others. And just as importantly, teach young doctors and nurses here and internationally those skills. So there's very, very few words that would adequately do justice to the respect and the gratitude we have for all of you. And this is a very important chapter in our history, meaning the history of the Sydney Medical School, that we can work together with all of you. And as has said earlier by Miss Rhonda Piggott from the Department of Foreign Affairs and Trade, those friendships, those ties will endure and go on and build relationships in all the years ahead. So thank you for being with us, and I hope that your stay here is wonderful, memorable, certainly safe it will be, but that you also have some of the joys of going on a boat trip on the harbour, going to the Opera House and enjoying some of the very nice Asian food in Sydney. Thank you.
If you would like to stay. So we've now come to the part of the programme where we'd like to invite Professor Bruce Robinson, to make the presentation of the Australia Awards Programme Pack to our 25 fellows, and also something to our 5 other fellows. And if you would stay here, just and Miss Rhonda Piggott, if you would come and be in attendance as well. So we have a real presentation. Now, Sydney, so you can read the minutes?
I'll try my very best. After the first few, I might need help. Okay. So the first one I would like to invite is Professor Dr. Tim So. And then also ATT. So afterwards, I have my colleague. Dr. K.B. Luin, Associate Professor from University of Medicine. Oh, very good. And Dr. Chong Suma, extra from University of Medicine. And Dr. Yi Wei, extra from the University of Medicine, Mandalay. Dr. Tutu Sui, Associate Professor from University of Medicine, Hubei. And Rohit Ray, Associate Professor at University of Lansing, Singapore. And Donna Sui, Associate Professor at University of Lansing, Mandalay. And Dr. Sanda, Deputy Director at NCH, Yangon Health Office. And Dr. Tini Lui, Deputy Director at Ghana Reproductive Health Foundation. And Dr. Miu Miu Mo, Assistant Director, Maternal and Reproductive Health Division. Department of Public Health. And Dr. P. Sanna, Assistant Director, Basic Health Services, Department of Public Health. And Dr. Lunwini, Assistant Director, Child Health Development Division, Department of Public Health. And Dr. Winnie, State Health Director, Section State, Department of Public Health. And Dr. Amjad, please, State Health Director, State, Department of Public Health. And Dr. Lee George, State Health Director, Eastern State.
It's quite different.
And Dr. Simon Solai, Deputy State Health Director, Southern Chancellor, Department of Public Health. And Dr. Kang Wei Han, Medical Officer, Myanmar Madonna and Child Welfare and Dr. Somyo Aw, Assistant Director, Child Health Development Division, Department of Public Health. And Dr. Myo Nguyen, Consultant Obstetric and Gynecologist, Department of Health. And Dr. Kinleya, Lecturer, University of Medicine, Mumbai, Consultant Obstetric and Gynecologist. And Dr. Wunwi, Lecturer, University of Medicine, Mumbai, Consultant Central Women's Hospital. And Dr. P, Senior Consultant, Children's Hospital, Dr. Wunwi Ma, Senior Consultant, Obstetric and Gynecologist, but they General Hospital.
Can we ask the five fellows who have been here for some time and therefore already have their DFAT bags to come forward and receive a small gift from the
The first one I would like to invite is from me is with A.
I'm not sure how the, I think it was more that we could provide what they needed, so and like this is our group of yeah, I mean they were paid for the accommodation I'm not sure it's
That concludes the formal proceedings this afternoon. The only thing that remains is a group photo. But I would like to just express my thanks again to the course organisers here, Professor Kirsten Black, Dr. Shalendra Solshorster and Dr. Anne-Marie Tao. To David Boyd in the Office for Global Engagement, who has been helping with the preparation, as was mentioned, and in particular to Siliso from the Office for Global Health, my own office, who has put in a tremendous amount here. So, and thank you all for coming. Thank you particularly and welcome again to our Myanmar colleagues. Thank you to all the speakers who have added to this, the enthusiasm that we can feel in the room about this very special course. So if we can have a group photograph now. Denise, are you going to organise?
I guess we'll invite all the this is our Is that okay? Anyone see the camera?
Balances? Yep. Oh, Susan, that's it. Good.
Can everyone see Sava? If you can't see him, it means you can't see your face. So if you can see Sava. Yes.
So everyone's in.
Okay, good. Yeah.
3, 2, 1. 3, 2, 1.
Hold it, I think there's some more at the back.
Okay, Roger, come on. And the 5 fellows, please. The clinician.
Would you like me to take one for you? Yes, no problem.
Oh, yeah, Roger.
Leslie, did you want to say that? No, you can do that one. You should come.
Okay.
Leslie.
Do you want to stay in this chair here? Yes.
Be careful,
Yeah.
You are going to sit down?
You don't leave them. This is going to be a very high shot.
Is that okay? The youngest.
The 3, 2, 1. I can't see you. That's good.
Squeeze it out there.
Yeah, very good. 3, 2, 1.
Okay.
Raymond and
Raymond, come on.
C. Sai. Where is the little lady? There's a little lady, our student. We lost a student already.
Everyone's so quiet getting their photo taken.
And Yi, why don't you come in?
Very quickly. And I can go right at the back.
Maybe I should take the photograph. You're in.
Me?
Yes.
Good.
We're going to get up on the chairs, please.
Yeah.
In front of
Be careful.
Okay, 1, 2, 3. 1, 2, 3.
Well done.
It shows what we can do.
ဆရာဒေါက်တာတင့်ဝင်နေပေါ့လေအခုဗမာပြည်ကကျောင်းသားတွေလာပြီးတော့ပေါ့လေပညာလာသိမှုတွေဗမာပြည်ရဲ့ကျန်းမာရေးဆိုင်ကိစ္စတွေလာပြီးတော့တိုးတက်ဖွံ့ဖြိုးလုပ်တဲ့ဟိုတွေ့ရတော့ဘယ်လိုများစိတ်ခံစားရပါလဲကျွန်တော်ရန်ဝန်းတာတယ်ဗျာဒီနေ့ကတော့အောင်မြင်လို့ခေါ်ပါပေါ့နော်ကျွန်တော်လည်းဒီမှာဟိုမြန်မာနိုင်ငံဆရာဝန် BMA အသင်းအနေနဲ့ကျွန်တော်တို့မျိုးတွေကျွန်တော်ကျိုးပန်းကြတာကြားပါပြီအဲ့တော့ဒီနေ့ Sydney University ကနေပြီးတော့ဒီ EAF ခေါ်တဲ့ Australia Award Fellowship ဆိုပြီးတော့ဗမာပြည်ကဆရာဝန်တွေ25ယောက်သူတို့ခေါ်ထားတာရှိပါတယ်အဲ့ဒီမတိုင်ပြီးမှလည်း Adelaide က University ကနေပြီးတော့ပေါင်းပြီးတော့နောက်ထပ်9ယောက်သူတို့ခေါ်ထားတာရှိပါတယ်အဲ့လူတွေစုပြီးတော့တက်ခေါင်မဲ့လူတွေရှိပါကျွန်တော်တို့ဖိတ်တယ်ကျွန်တော်လာတက်တာအဲ့လိုကျွန်တော်မြင်ရတဲ့ခါကျတော့ဒီ Australian အစိုးရအနေနဲ့ရောဒီ University of Sydney အနေနဲ့ရောအားတက်တယ်ရောဒီကျွန်တော်မြန်မာနိုင်ငံဆရာဝန်တွေကိုကူညီတာတွေ့ရတော့အများကြီးဝန်တာပြပါတယ်အဲ့ဒီလိုပေါ့လေအစီအစဉ်အောင်မြင်လာအောင်လို့ဆရာတို့ဘယ်လိုချိုးပန်းဆောင်ခဲ့တယ်လေသိပြသေးတယ်ဟုတ်ကဲ့ခင်ဗျာကျွန်တော်တို့ကတော့ဒါမျိုးညှော်မှန်းတာကြာပြီပေါ့ဗျာဟုတ်ကဲ့အဲ့တော့ကျွန်တော်ပြောရမယ်ဆိုလို့ရှိရင်တော့2012မှာလေကွာကျွန်တော်လည်းဒီလို program မျိုးကိုကျွန်တော်တို့ဒီမြန်မာ community ကိုသားပြုပြီးတော့ဒီ BMA အနေနဲ့ကျွန်တော်ကျိုးပန်းခဲ့ပါတယ်ကျိုးပန်းခဲ့တော့ Sydney University နဲ့တွဲပြီးတော့ကျွန်တော်တို့ဒီဟိုတွေကိုpost 8ကိုရှောက်ပြီးတော့ကျွန်တော်တို့ EAF program ပေါ့လေအဲ့ဒီမှာကျွန်တော်တို့ပထမဦးဆုံးအနေနဲ့ဒီကျွန်တော်တို့ maternal child health seminar ဆိုပြီးတော့ international seminar ကြီးတစ်ခုကျွန်တော်တို့လုပ်နိုင်ခွင့်ရှိပါတယ်ဟုတ်ကဲ့အဲ့ဒီတုန်းကတော့candidate 6ယောက်တော့လေလာနေတယ်ဒုတိယနှစ်မှာကျွန်တော်အလားတူဟာဒီတစ်ခုကိုကျွန်တော်တို့ကနောက်ထပ်ဒီဗမာပြည်ဆရာဝန်တွေ14ယောက်လောက်ပေါ်ပြီးတော့ another maternal child promotion အတွက်ပေါ့လေ health promotion အတွက်ကိုကျွန်တော်ခေါ်နိုင်ခဲ့ပါတယ်တတိယနှစ်က2014ပေါ့ last year HIV AIDS အတွက်ပတ်သက်ပြီးတော့ international conference မဲပေါ်မှာကျင်းပတော့ဗမာပြည်ဆရာဝန်တွေကိုပဲကျွန်တော်14ယောက်လောက်ခေါ်ပြီးတော့အဲ့ဒီ conference တက်ခွင့်ရှိတယ်ကျွန်တော်တို့မဲဘုံမှာလည်းတို့နဲ့လေးလာခွင့်ရှိတယ်စစ်တီမျိုးမှာလည်းလေးလာခွင့်ရှိတယ်ဆိုအားလုံးပေါင်း30တရက်လောက်ကျွန်တော်တို့ဒီမှာဆောင်းရနိုင်ခွင့်ရှိပါတယ်အဲ့တော့အဲ့လိုခေါ်တဲ့ချိန်မှာကျွန်တော်တို့စဉ်းစားတာဒီဗမာပြည်မှာကျွန်တော်တို့ဒီကျန်းမာရေးနဲ့ပတ်သက်ပြီး capacity building ခေါ်တာပေါ့လေလက်ရှိပြီးသားလာဒီအမှုရန်နေရာရန်နေဆရာဝန်တွေကိုအည်သွေးပြင်ပေးဖို့နောက်ကမြန်မာနိုင်ငံပြည်မှာရှိတဲ့ပြည်သူပြည်သားတွေကျန်းမာရေးပညာဖွံ့ဖြိုးဖို့ဟုတ်ကဲ့ဘယ်လိုနေရာနေပြီးတော့ဘယ်လိုကျွန်တော်ကိုကြီးကောင်းပြီလို့စဉ်းစားတဲ့ခါကျတော့အခုဒီ program အတိုင်းမှာကျွန်တော်မြင်တာကတော့ဒီ sector မျိုးမျိုးပေါ့ဥပမာ public health ဆိုရှိတယ်နောက်ပြီးတော့စေကူသားတွေနဲ့အဖွဲ့ရှိတယ်တက္ကသိုလ်ကစာပြတဲ့ဆရာတွေရှိတယ်နောက်ခါကျတော့ဒီ research လုပ်ထားတဲ့ researcher တွေရှိတယ်အဲ့ဒီအုပ်စုတွေလည်းပါ specialist ဆိုလို့ဆိုလဲဒီကလေးတူဆရာဝန်တို့ပါပွားမိရဆရာဝန်တို့ general practice တော့အဲ့ဒီကကျွန်တော်တို့ကရွေးပြီးတော့ဟုတ်လားအကုန်လုံးကိုကျွန်တော်ဖြန့်ပြီးတော့ခေါ်ရတာပေါ့ရှိတယ်အဲ့တော့ခေါ်တဲ့အခါမှာကျွန်တော်အော်မီနဲ့တွေ့ကြအောင်ကျွန်တော်ဒီမှာပေးလိုက်
တဲ့ဒီမှာ City University ကိုကျွန်တော် City မှာလာပြီးတော့ဒါတွေကိုတွေ့ပြီးတော့လေ့လာရတဲ့ဘုသူရတဲ့ပုံစံကျေကျေပြတ်ပြတ်ပမာပြီးကိုဖြတ်ပြီးတော့ပြီးဖို့ကျွန်တော်ကြိုးစားခဲ့တာအောင်မြင်ခဲ့တယ်ကျွန်တော်ယူဆပါတယ်ဟုတ်ကဲ့ဆရာအဲ့တော့ရင်ကျွန်တော်တို့ဒီမှာတွေ့ရတာအမတန်ဝင်လာတယ်ဒီဆရာတွေကလည်းအများကြီးကြိုးစားပန်းစားပေါ်လေစိတ်ဝင်စားပေါ်လေဆောင်ရွက်နေတာတွေ့လေ့လာနေတာတွေ့ရတယ်ပဲနောက်မို့လေဒီလိုသင်တန်းတွေကိုဆက်ပြီးတော့လုပ်ဖို့အစီအစဉ်တွေဆရာမရှိပါလားကျွန်တော်တို့ကရှိပါတယ်ခင်ဗျာဥပမာဆိုတော့ရှင်းနေဆိုလို့ရှိရင်လည်းကျွန်တော်တို့ဒီမှာရှိတဲ့ Royal Australian College of General Practitioners ဆိုတာကကျွန်တော်တို့ဒီprimary care ပေါ့နော်ဘာခေါ်လဲကျွန်တော်တို့ဒီ family medicine ကုတဲ့ဆရာဝန်တွေသူတို့ကတော့ကျွန်တော်တို့ဆေးပညာနဲ့ပြောမယ်ဆိုတော့ရှေ့မျက်နှာပြမှာပေါ့ရှေ့မျက်နှာနေတဲ့တော့ရွာတိရောက်တဲ့ဆရာဝန်တွေဖြစ်တော့သူတို့ကိုကျွန်တော်တို့ educate လုပ်ပေးခြင်းအပြင်သူတို့ရဲ့အရေးတွေကိုမြင့်ပေးခြင်းအပြင်ဗမာပြည်လူတွေအများကြီးအကျိုးရှိဖို့ကျွန်တော်တို့ကပြောလင့်ထားတယ်ပေါ့လေအဲ့တော့အခုကကျွန်တော်တို့ကဒီမှာရှိတဲ့ Royal Australian College of General Practitioners တဲ့ဗမာပြည်ကနော်ဆရာဝန်ဖွဲ့တယ်ပေါင်းပြီးတော့သူတို့ခေါ်ပြီးတော့ဒီမှာ credit ပေးဖို့သူတို့အစီအစဉ်ရှိပါတယ်။နောက်ဒီနေ့ကဘာကြီးမှာဆိုလို့ရှိရင်ရာသီဥတုကပူပြီးတော့ပြင်းထန်လာတယ်။အဲ့ဒီခါကျတော့ဒီ environmental list တွေပေါ့လေခေါ်ဖို့အစီအစဉ်ရှိပါလား။ဒါမှကျန်းမာရေးနဲ့ပတ်သက်ပြီး temperature မြင့်လာရင်ယောဂကူးစက်မှုတွေများလာမယ်။အဲ့ဒါနဲ့ပတ်သက်ပြီးကိစ္စတွေနောက်ပြီးတော့ဒီဆေးဘက်ဆိုင်ရာပညာပေးကိစ္စတွေပေါ့လေ။အဲ့ဒါနဲ့ပတ်သက်တဲ့ပြည်သူလူထုကျမ်းမာရေးဆိုင်ရာဟောပြောမဲ့လူတွေဒါမှမဟုတ်တင်ကြားထားတဲ့လူတွေပေါ့လေဒီ research ရှာတွေအဲ့ဒါတော့ဒီ green လို့ဟုတ်ကဲ့ NGO တို့အစိုးရအဖွဲ့လူတွေကိုခေါ်ဖို့အစီအစဉ်များစဉ်းစားထားပါလားအဲ့ဒီ question ပေးတာကျွန်တော်ကျေးဇူးအများကြီးတင်ပါတယ်ဘာကြောင့်ကျွန်တော်တို့ဒီ Australian အစိုးရရဲ့ policy ပေါ့လေ ALAF ကကျွန်တော်တို့ခံယူချက်တစ်ခုဟာကျွန်တော်တို့ကမ္ဘာမှာဒီလိုရာသီဥတုအတယောက်ပေါ်တော်လေးကောင်းနော်နေရေးထိုင်ရေးအရာပေါ်လည်းကောင်းကျန်းမာရေးဖွံ့ဖြိုးဖို့နဲ့ပညာရေးဖွံ့ဖြိုးဖို့တက်ဖို့တွေကရည်စူးတာဖြစ်ပါတယ်အဲ့တော့ရည်စူးတော့ကျွန်တော်တို့ကဒီကျွန်တော်စစ်ပညာအခန်းမှာပဲခုနကပြောတဲ့ public health ဆရာဝန်တွေ university ဆရာဝန်တွေ lecturer ပါခြင်းအပြင်နောက်ပေါက်ဖွာလာမဲ့နောက်ပေါ်လာမဲ့ဆရာဝန်အငယ်လေးတွေကိုလည်းကျွန်တော်တို့ကဒီ educate လုပ်ပေးမယ်သူတို့ကလည်းဒီမှာလာပြီးတော့ကျွန်တော်တို့ဒီမှာလုပ်တာခိုင်းတာကြည့်ခြင်းအပြင်ဒီလူတို့ကိုဘယ်လိုပညာပေးရင်ကောင်းမလဲဆိုတော့ဒီကနေတို့ရအောင်အဲ့ဒီအတွက်ကျွန်တော်တို့ဒါခုနကပြောတဲ့အတိုင်းကိုကျွန်တော်ဒီ policy မှာပါပါတယ်အဲ့ဒီအတွက်ကိုကျွန်တော်တို့စူးစမ်းနေပါတယ်အခုလိုပေါ့လေစိတ်ရှိလက်ရှိရှင်းပြတဲ့ဒေါက်တာကျေးဇူးတင်ပါတယ်ကျေးဇူးတင်ပါတယ်ဗျာ